All right. Well, we are going to get started. As participants join us in the seminar, feel free to jot down your questions to ask them at the conclusion, or you can also put them in the chat and I will address all of our questions at the conclusion of my presentation. So let me first begin by introducing myself. My name is Dr. Elicia Harris. I am a board certified OBGYN in the Indianapolis, Indiana area. And I am a co-founder and chief medical officer for Navigate Maternity. And so I today am going to begin this seminar with an high level introduction of not only Navigate Maternity, our application, just pregnancy in general. I feel like pregnancy is just such a time that where you can feel overwhelmed. There's just a lot going on with your body, a lot going on with changing lifestyle and anticipatory things that your mind is just constantly wondering and triaging. And Navigate Maternity truly offers support, education, and I want to highlight all that we can do to support you through your pregnancy journey with this presentation. So with that, let's get into talking about Navigate Her and Navigate Maternity. So, who are we? We are truly whole mom care, not simply vitals. We are a company that is founded by Black women, designed for every woman, with a focus on health equity, knowing that Black women have the most to gain from achieving health equity. Navigate Maternity was founded on the belief that every woman deserves a safe, supported, and dignified perinatal journey. Too often, women, especially those from rural and underserved communities, receive care that is frankly fragmented or just impersonal. We're here to change that narrative. Navigate Maternity ensures every woman receives the care she truly deserves, empowering, respectful, and rooted in her real life needs. That's why we created Navigate Her, a mobile community offering the clinical tools, emotional support, and essential products every woman needs during pregnancy and her first year postpartum. With Navigate Her, you'll receive tools to track your clinical and mental well being, trustworthy, clear education for every stage of your pregnancy journey, nutrition, mental health, and social support resources for you, essential products like blood pressure cuffs, compression garments, and lactation devices. Every mom, every moment, every measure that matters. So, what is Navigate Her? Navigate Her is truly personalized pregnancy support that you can have at your fingertips anytime, anywhere. With our Navigate Her app, you can do the following. You can monitor your blood pressure using our devices, monitor your weight using our scale, assess your mood with validated tools. We have self-paced education that is organized by trimester and topic. So you can search through our library or catalog to truly educate yourself on the topics that matter to you or that are more pertinent at a specific time. We have some frequently asked questions that are backed by science and compassion. We screen for emotional and social needs with quick check-ins. We connect you with local resources for social, emotional, and newborn needs. And we provide access that is essential to pregnancy products that you may need throughout your entire journey, whether that's blood pressure cuffs, compression garments, or lactation supplies. We don't just monitor, we empower. So at Navigate Maternity, we truly want to focus on making each mother feel fully supported throughout her entire pregnancy journey. We begin this with that first diagnosis, with the positive pregnancy test. So during the first trimester, we'll have several resources that will be highly valuable: hypertension classes, other educational seminars and classes, such as the one that you're attending right now, compression socks, assessments of the social determinants of health, and Edinburgh, which is a tool that is used to assess mental well being. At that time, your clinician has the opportunity to prescribe you our Navigate 180 or 360 kits. The 180 kit utilizes our validated blood pressure cuff. The 360 kit utilizes our validated blood pressure cuff in addition to a Bluetooth connected scale. Then you also have the ability to engage with our app. All of this data is captured, that can be utilized to serve as a companion to your traditional prenatal care journey. And in the second trimester, we focus on after you've taken your glucose test, should you happen to have gestational diabetes, the ability to check your blood sugars through our diabetes tracker component of our app. We also have supporting classes and resources for diabetes education. In the third trimester, we'll focus on preparing you for birth, whether that's ensuring that you have your lactation supplies, delivering and having a breast pump tracker that you can log your lactation journey in that postpartum period. And we also offer supplies that help you with your recovery, whether you have a vaginal delivery or cesarean section. But should you have a cesarean section, we do have abdominal binders and some wound care supplies. Additionally, in that postpartum period, we have lactation classes and support. We have certain seminars that are focused on preparing our mind, hearts, and bodies for a potentially scheduled C-section recovery. Also, that unexpected cesarean section recovery. We provide you with breast pump supplies, whether it's the lactation device, also the tubing. And then again, you can utilize our 180 and 360 kits / blood pressure monitoring devices throughout that entire year postpartum. So now I'm going to just switch to a discussion of some things that I think are very pertinent and also knowledgeable, um, evidence-based things that will be vital to your understanding as you enter your pregnancy journey. So let's take it back to the beginning, to the first positive pregnancy test. There's a flood of emotions, whether that's happy, whether that's shock, whether that's denial. But as you are processing all of your emotions, there's some things that I definitely want you to think about it at the forefront to ensure that you have a very safe pregnancy journey. Let's start with taking a prenatal vitamin, especially one that has 100% of the folic acid that you need. Why is this important? Folic acid, or folate, is metabolized in our bodies and used to help the fetus and develop very early in the embryology of the fetus development. Should you be deficient in folate, that can result in a birth defect called spina bifida for your baby. And so that's why it's important to take, prenatal vitamins that are full of folic acid, in addition to eating green leafy vegetables that are natural, have natural high levels of folate. And so we'll talk a little bit more about nutrition in future slides, but wanted to first start with that point. Then you want to make an appointment with an OBGYN or a midwife, and we'll talk a little bit more about the importance of your selection and some things that can help guide that choice. Thirdly, you want to avoid unapproved medications that are not safe to take in pregnancy. You also want to avoid consuming alcohol, tobacco products, and illicit drugs. We want to eliminate things that could result in you getting foodborne illnesses during pregnancy. So raw fish, such as sushi, undercooked meat, soft cheeses, these types of foods have natural bacteria that exist sometimes at high levels, and that can result in you getting a serious illness. And a serious illness early in pregnancy can cause birth defects and even pregnancy loss. So we want to make sure that we're not consuming those things. You want to talk to your family members about your personal family history. You want to make sure that you record all of the previous medical diagnoses, surgeries, medications that have been taken, um, and your own pregnancy history as you prepare to discuss this with your healthcare team at your upcoming prenatal appointments. And you also want to ask your mom about some of the things that she may have encountered during her own pregnancy, such as, did she have gestational diabetes? Does she now have type 2 diabetes? Does she have chronic hypertension going into pregnancy? Did she develop preeclampsia? Studies show that should a first degree relative have significant pregnancy complications, that does increase the likelihood of us as a first degree relative of experiencing similar complications. So let's go back to talking about choosing a provider for your prenatal and postpartum journey. So it's so important that you find a healthcare team that you feel like you can connect with, that you have a rapport with, that you trust, that you feel like listens to you, respects you, and makes you feel safe and supported. Some things that I think that are vital to consider is, again, do you feel heard, respected? Do you feel comfortable asking questions? Secondly, are they experienced in caring for a patient that is within your scope? And do your does your healthcare needs and their scope of practice align? For example, if you are a high risk mom, a midwife is likely not someone that will be a suitable provider for you, just because your complexities of your pregnancy may be out of their scope of practice for them to truly provide you with safe care. Thirdly, are they affiliated with a hospital or a birth center that meets the needs that you have for your pregnancy? Such as, if you are a high risk mom, does the healthcare facility have a maternal fetal medicine department? If you are a low risk mom and you plan to deliver at a birth center, is there a collaborative agreement that should you develop um, an emergency during labor or during your prenatal journey, which would risk you out of low risk care, is there collaboration with a hospital that has a higher level of care that they can work together to ensure that you're getting continuous care and not experiencing interruptions in your prenatal care journey? Fourthly, how do they handle emergencies, labor decisions, and delivery preferences? Are there things that you could utilize, such as nitrous oxide, doula services, tubs, if that's a desire of yours? Does the facility that you plan to deliver at have the infrastructure or to support you, and do they have some of the things that are just things you desire to be a part of your labor and delivery journey? And lastly, do they support shared decision making and discussion of your birth plans? I think it's important to have a team-based approach. You want to be able to feel comfortable that you can have a birth experience that represents what you desire, but within the guardrails of safety. And I think that you can arrive to a compromise with a discussion with a healthcare team that you know supports and listens to you. Let's talk a little bit more about some factors that can be a part of one's medical history or lifestyle that can make them considered high risk. So some of the common risk factors, again, this is not an all-encompassing list, but a common risk factor is obesity or having an elevated BMI. Second is smoking or secondhand smoke exposure in your home. Also, having to utilize fertility reproductive technologies such as IVF, in vitro fertilization, or IUI, intrauterine insemination, or any of the other medications that help to stimulate ovulation. Also, being at the extremities of age, whether that's very young or older in life when you have a baby, being less than 21 or older than 35, which we call advanced maternal age. Also having a pregnancy history that was somewhat complicated, such as having gestational diabetes in a previous pregnancy, or complications of high risk, that would make you high risk from a hypertensive standpoint, whether that's preeclampsia or gestational hypertension. Another thing that makes one at higher risk is having had a preterm birth, experiencing a C-section in a previous pregnancy, or had bleeding complications during pregnancy, or excessive bleeding in that postpartum period. Also, having an autoimmune disorder or inflammatory disorders, those can also increase your risk during pregnancy. And lastly, we'll mention having had a child that has had a previous birth defect. Let's discuss a little bit more about just some basic things that are vital to know about nutrition and exercise during pregnancy. So, some tips for nutrition. We want to aim for a balanced diet that focuses on eating whole foods, lots of fruit, lots of vegetables that are rich in natural fibers, whole grains, and lean proteins. You also want to continue to take your prenatal vitamins, as we previously discussed. And if you feel like your diet is not all encompassing of vital nutrients, it might also be worthwhile to look at taking some nutritional supplements, such as additional vitamins beyond just your traditional prenatal vitamin. Um, and also maybe taking some supplemental drinks like protein shakes, ensure those kinds of things that have a lot of vitamins and minerals. You want to make sure that you're drinking lots of water. It's very common to experience constipation during pregnancy, and so water will also help with that. And also, drinking lots of water helps to maintain your blood pressure, which naturally drops in that first and second trimester, which can leave you feeling very weak and dizzy and lightheaded and fatigued. So, you want to make sure you're getting a lot of hydration. We want to avoid the junk foods, the things that are just ultra processed and don't have a lot of nutrition that is really important to achieving a balanced diet. Again, you want to make sure you're getting a good amount of fiber to help with constipation, and you also want to get a lot of calcium and vitamin D in your diet. That will help to support your fetus, your baby's development as well. And I know that often people will comment, "Oh, you're eating for two during pregnancy." Unfortunately, that is not truly the case. We'll talk a little bit more about appropriate weight gain in pregnancy on a future slide, but a healthy calorie goal is 1,800 to 2,000 calories per day, unless you are instructed otherwise due to certain medical conditions by your care team. And again, we want to revisit the fact that you want to avoid certain foods that could potentially be a vector for bacteria, such as fish, sushi, deli meats, undercooked meats in general, like eating medium rare steaks. And you also want to avoid those soft cheeses. When it comes to exercise, we want to keep moving. It's so important to be active. Most types of movement or exercise are very safe in pregnancy. And as a rule, I often say if you were doing it before pregnancy, continue to do it during pregnancy. So, especially those things like CrossFit, walking, jogging, those cardio base and strength training or resistant training workouts are great for your endurance, your health throughout pregnancy, and definitely for recovery from after having a delivery. If you come into pregnancy not having an established exercise routine, I would look at just starting just to be more active in general, whether it's just simply taking a walk every day, just getting up and moving, just increasing your daily expenditure of calories will help you to have a smoother pregnancy and recovery period. You also will reduce your risk of needing a cesarean section, specifically for indications such as where you push and push and push and push for hours and just can't deliver that baby, just due to exhaustion. And so, especially that first time that you have a baby, it is a very strenuous process to deliver a child vaginally. And so you want to be well prepared for that. And sometimes women can push up to 3 hours or more with an epidural, and that is actually considered within normal. And I think of doing any type of physical labor or activity for 3 consecutive hours sounds exhausting. And so that's why it's just so important to be active and train your body to have a baby. Also, you want to just listen to your body and you want to talk to your provider about anything that you're unsure about. If, exercise is causing you to have a lot of pain and things, something just doesn't feel right, make sure you communicate that. Now let's revisit the subject of weight gain. So, gaining weight is just a physiological process that we cannot avoid during pregnancy. It happens to all of us, and a normal amount of weight to gain during pregnancy is 40 pounds for most individuals. However, if you are in the category of a BMI of greater than 30, which is technically what we medically diagnose as obesity, we want you to try to limit your weight gain to 20 pounds or less. And why is this important? Because excess weight gain during pregnancy is something that happens more times than not. The average weight gain that most women experience during pregnancy is 60 pounds, which is 20 pounds more than what's recommended. And having excessive weight gain during pregnancy actually increases the risk of pregnancy complications. We discussed on one of our first slides that obesity independently, just by itself, was a risk factor for pregnancy complications. So it increases your risk of needing a cesarean for delivery, increases the likelihood of you having gestational diabetes, increases the likelihood of you experience hypertensive disorders such as developing gestational hypertension, high blood pressure, preeclampsia. Also increases the risk of developing postpartum infection complications, whether that be of a cesarean incision wound or of the actual uterus, which is called postpartum endometritis. And also, it increases the likelihood that your baby may develop obesity or type 2 diabetes. And so it's been well studied that women who are of a higher weight tend to have children who are of a higher weight. So it's very important for you to establish these healthy lifestyle techniques and goals during pregnancy so that when you're postpartum, you have a smoother recovery and a shorter time to return to your baseline or slash pre-pregnancy weight. I want to visit the subject of medication and just overall some pregnancy safety tips to be mindful of. So when you're pregnant, it's important that you don't take anti-inflammatory medications such as ibuprofen. That is because there's a component of those medications that can affect the developing fetus heart. And so you want to avoid ibuprofen, naproxen, those types of medications for pain or discomfort, and more so just focus on just utilizing heat, hydrotherapy, which is otherwise hot water, or like a heating pad. And then also, you can take Tylenol for if you wanted to truly take a medication that was safe in pregnancy. Some over-counter medications are safe to take, but it's always best to check with your provider or your healthcare team first. A lot of clinicians will have a list available to you of safe over-the-counter common medications, for reassurance and guidance. And some of those medications just are for common things that most people experience on a day-to-day basis, such as allergies, your common cold symptoms, such as just cough, fever, sore throat, etc., headaches, heartburn. So there are many medications that are safe to take, but even medications for certain symptoms may not be safe to take. So it's again to great to refer to a list, or if you're not sure, just contact your healthcare team. Other things to note is that you want to avoid changing a kitty litter box in pregnancy. Cat feces can have a parasite within them called toxoplasmosis, and that can actually cause birth defects and congenital issues within a developing baby slash fetus. And so it's important that if you have a cat, that you not change the cat's litter box and you get somebody else to do that for you. If there's no one else in your home and you have to do it, I would advise patients to wear gloves and wear a mask so that the dust from the kitty litter, you do not inhale or ingest that by accident. Secondly, you want to use bug spray or bug repellent to prevent you from getting illnesses that come from mosquito bites, such as West Nile virus or Zika virus. Zika is usually more so in the Caribbean or areas that are near the equator. And so when traveling, you want to make sure that you also pack some bug spray to protect yourself from getting illnesses from mosquito bites. You also want to consider reducing your exposure to microplastics by avoiding heating or reheating food in plastic containers. Try to reduce your use of plastic water bottles, especially if it's been in a hot car, and use more reusable silverware that is, sterling silver or stainless steel water bottles, just to reduce exposure to microplastics. There's actually been some research and literature that's come out that just evaluates the level of microplastics in placentas, and some surprising data is that when we analyze the placentas that have resulted from pregnancy losses, there's significantly higher levels of microplastics in those placentas, which I've found to be interesting. And hopefully we'll have more data in the future to give us some more guidance about what's a safe level of plastic use during pregnancy to try to minimize uh, an outcome that may impact your pregnancy. Lastly, I want to encourage everyone to continue to wear masks in crowded spaces or the airplane, especially during the flu season. And if you're in an area where you know that there's been a resurgence of COVID cases, you want to just try to minimize your exposure for respiratory illnesses by wearing a mask. And then we're going to address a very common experience during pregnancy, unfortunately, which is the nausea and vomiting. So, nausea and vomiting in pregnancy, which is often referred to as morning sickness, is the result of your hormone surges. So that's why it's more common in the first trimester. It can be very frustrating, and be also very much a barrier to just your daily activities of living. So there's some common things that you can do. However, if you've tried these things and it is just not getting better and it's really interfering with your ability to work, to care for other children, and just function as an adult, I highly recommend that you discuss this with their healthcare team, because there are some additional prescription medications that I'm not going to discuss at this time, but they can be prescribed and can truly help to minimize your symptoms. It's important that we consider eating very small yet frequent meals during pregnancy. And the reason for that is that our stomach acid makes us nauseous. So when you have a lot of stomach acid and an empty stomach, that promotes the symptoms of you feeling nauseous and wanting to vomit. So by having some food in your stomach, whether it's just a small little quantity, it can neutralize that stomach acid and really help minimize your symptoms. And for that reason, you also want to avoid adding additional acid to your stomach acid. So, things that are naturally acidic that we may encounter in our diets are like citrus fruit, oranges, lemons, limes, tomatoes, tomato sauce. Coffee is very acidic. Spicy hot foods, those can also promote your stomach to produce more stomach acid. Again, you want to stay very well hydrated. Water is a natural medium for our body, and that can help mitigate that excessive acid production. You also want to try just like mints, hard candy, ginger flavored things seem to help with nausea, whether that's ginger tea or ginger chews or ginger candy. Also, another natural thing that can help to mitigate nausea is to take vitamin B6. You can just take generic vitamin B6 that's over the counter, up to twice a day. If you take vitamin B6 in combination with an antihistamine such as Unisom or Benadryl before you go to sleep, those two medications together really work well at helping to um, not experience quite as much nausea during pregnancy, especially when right before you lay down to go to sleep and that stomach acid can come from your stomach back into your esophagus. You can also take Tums and antacids, again, addressing the stomach acid in your stomach to mitigate those symptoms. And then you want to avoid triggers. You know, if there's certain smells that you just can't do, whether that's cologne or the smell of eggs, I know is often triggering for people when they're pregnant, or getting in a place where you feel very hot. You know, today is a very warm day here in Indianapolis, and so I would try to encourage most women in that first trimester to sit inside with the feet up in the air conditioning if possible. Some things that I think is important to know that are not normal during the first trimester of pregnancy that you truly should not be dismissive of. And should you experience these symptoms, you really want to contact your healthcare team to make sure that they are addressed and you are further evaluated for why these things are happening. Firstly, is vaginal bleeding, more than just spotting, more than just a drop of blood on the tissue paper. If there is a wide streak, if there's anything that looks similar to your period, even on the light days of your period, that's not normal to experience that during pregnancy, and it really needs to be evaluated. Also, should you experience very severe abdominal and pelvic pain, that when you take Tylenol or use a heating pad, it does not touch it. That is not at all normal, and you really need to be evaluated in a healthcare setting. Also, again, nausea, vomiting, that is debilitating, that prevents you from eating a normal amount or drinking a normal amount where you feel dehydrated or and hungry all the time and undernourished, then you really need to address that with your healthcare team. Let's talk about the pregnancy journey a little bit more. So, typically, most women will have their very first OB appointment, which we call the new OB visit, between 8 to 12 weeks. If you have a history of a pregnancy complication, especially one that it happens in the first trimester, such as having had an ectopic pregnancy, it's important that you have that first appointment earlier than 12 weeks. You definitely would want to, if you have experienced an ectopic pregnancy, get a dating scan very early to ensure that your pregnancy is in the correct location, because having experienced an ectopic pregnancy in the past increases the likelihood for you experiencing another ectopic pregnancy in the future. And then after that new OB appointment, most women who have an uncomplicated pregnancy will have prenatal appointments every 4 weeks until they get to be around that third trimester, which is 26 to 28 weeks. And then in the third trimester, you'll start to have appointments at a cadence of every 2 weeks until you get to be 35 to 36 weeks. And then after 35, 36 weeks, you're in that final month, that home stretch of pregnancy, and you'll have weekly visits until you have your baby. Most women get 2 ultrasounds at a minimum. That first ultrasound is the dating scan, which the earlier you have an ultrasound and see fetal cardiac activity or a baby's heartbeat, the more reliable it is to predict your due date. And so that's why we usually do that ultrasound somewhere between 6 to 10 weeks, 12 weeks, if no previous um, complications of pregnancy or a first pregnancy. Um, then that second ultrasound is more so to look at the baby's anatomy. And that is typically done between 18 to 20 weeks. And that will assess the baby's growth and that the baby's organs and limbs and all of those things look normal to screen for any congenital anomalies or birth defects. And then some patients will require more ultrasounds to assess the baby's growth and development, especially if there is something that is diagnosed as a congenital birth defect during pregnancy. You may need more frequent ultrasounds throughout your pregnancy as a result. It's very important that you build a support system that will help you navigate this journey into motherhood and in that postpartum period. Things that I want to again bring up that can help you in addition to navigate maternity, helping you with is some healthcare professionals who can be a further support. So firstly, you got us. You got Navigate Maternity, your team that is available at your fingertips via the Navigate Her app. Will provide you with the ability to monitor your biometric data and educational content and social support services and connection and community. Secondly, I would investigate a doula in your area. Some facilities have doula support services, and some types of insurance cover that, and some people's insurance does not. So it's important to kind of just check with your healthcare coverage to see if they cover doula services. And if they do, I think that they're a valuable asset to your your healthcare team during pregnancy. So I guess I should back it up and say, what is a doula? So a doula is not someone who delivers babies or delivers actual care, but they are what I call like a pregnancy bestie. They are a source of emotional support, of physical support. They're physically there for you to help walk you through your pregnancy journey and in that postpartum period. Also, it's important to have a nutritionist if you have any underlying medical issues, or you just want to, some advice on how to nourish your body and keep your weight in check during pregnancy and the postpartum period. I also often recommend that people engage with a mental health therapist. I think that it's important to have a relationship with a therapist going into delivery, so that should you experience postpartum depression or anxiety, you already have that connection, that rapport with that resource that can help you. And lastly, I think it's very helpful to have a chiropractor or a massage therapist as part of this team to support you. Chiropractors and massage therapists can really help you um, with dealing with day-to-day aches and pains and tensions and postural changes that can cause discomfort during pregnancy and that postpartum period, and address it in a very holistic way. It's also important for you to consider just your immediate circle, your family, your friends, who can also provide you with support during pregnancy and postpartum. Additionally, consider what other community resources you may need, whether that's addressing food insecurity, housing insecurity, other supportive services. It would be worthwhile for you to look at the things that are available to you in your neighborhood, in your network, that may be untapped resources for you. And then lastly, it's important to consider those peer supports, whether those are virtual things, or whether those are local community support groups, in addition to Navigate being there as a source of community for you through your journey. So again, we are here every step of the way to support you, to educate you, to empower you through community, through our biometric tools, whether that's our blood pressure cuff, our scale, all these things. We want to help you feel empowered to serve as an advocate for yourself, and also feel a sense of community to optimize your pregnancy journey outcomes. There is a QR code here for our Navigate Her app. Please download it. It is free. We would love to further engage with you through our application. And that concludes my presentation. We also want to connect with you via social media. Please follow us and engage with us via Instagram, Facebook, and TikTok. We love your feedback. We love your connection, and we're here to be of support to you.